All right, so this is chapter 9, part 1. We're going to talk about how we control microbes by physical means and by chemical means in this chapter. A lot of what we're going to talk about, it's best to know some of these terms as far as definitions, and that will help you long term to be able to kind of apply what these mean. So, controlling microorganisms, controlling how much exposure to potentially harmful microbes is important when it comes to our lives. The methods of microbial control used outside of the body are designed to result in 4 possible outcomes. Sterilization, which is by definition the removal of every viable microbe. So there's no living anything on whatever device we're talking about as far as that when we're talking about sterilization. And then there's disinfection and decontamination. Decontamination, sometimes referred to as sanitization. And then there is antisepsis. Antisepsis is also called degermination or degermation. I think there's supposed to be some more letters in there. I think it's degermination. Antisepsis, it's very important that you remember this, and I think I highlight this later on, that this is the only method used on living tissues. These 3 things used on inanimate objects. Antisepsis is specific to living tissues. Okay? We do not use antisepsis techniques on, dental utensils. We don't use sterilization on living tissues, okay? So it's very important that you remember antisepsis is specific to living tissues. All right, so here's some basics on these, kind of all put on a table. We have sterilization, disinfection, decontamination, or sanitization, and antisepsis. So here are the definitions. Sterilization destroys or removes all viable microorganisms. That includes viruses as well as endospores. Okay, so the hardest things to kill are endospores, and sterilization takes care of endospores and everything less difficult to kill. Disinfection, it's a physical process or chemical agent used to destroy vegetative pathogens. And remember, when we talk about vegetative pathogens, those are the ones that are alive and doing their thing, right? They're not in a dormant state. So disinfection does not take care of endospores. Disinfection also removes products of microorganisms, such as toxins, from the materials. Decontamination or sanitization is a cleansing technique that mechanically removes microorganisms as well as other debris to reduce the contamination to safe levels. So they use sanitization techniques in kitchens. You sanitize the utensils that you use to scoop out the salad dressings and such. So if you work in a hospital or you work in a food industry of any sort right now, I can't say this enough that I hope that you are following the guidelines put down by the regulators of all this, because by not doing certain things that are listed in the guidelines, you can make people sick. And just a side note, if you've ever, gotten up in the morning and maybe just had a piece of toast for breakfast, and then you go to lunch and maybe you have, a salad with, some tuna or something on it, and then later on in the day, maybe your stomach's a little upset, something isn't quite right. 9 times out of 10, it's something you ate. It doesn't mean you have a virus. It doesn't mean that you're sick. You can have some minor stomach upset and, a few trips to the restroom, and that can be caused 9 times out of 10 by something that you ate, within the last 24 hours, because some bacteria, as we've learned, take a long time to reproduce and do their thing. So just if you work in the food industry, please follow those rules because they're there for a reason. And then, of course, antisepsis reduces the number of microbes on human skin. Antisepsis is far from sterilization. It is not the same thing, and your skin, short of cutting your arm off and putting it in an autoclave to sterilize it, your skin will never be sterilized ever. It's just impossible to do. Antisepsis reduces the number of microbes on the skin, and basically, it's the best we can do. There's no other options there. Some few key points here, and note that scrubbing, mechanical friction helps with this cleaning of the skin to reduce the microbes. So if you ever find yourself in a bathroom where there's no soap, we've all found ourselves there, at the very least, running your hands underwater and using friction back and forth, scrubbing your hands as much as you can while they're running underwater is helpful. That does something. It's better than nothing. Just make sure you dry them well afterwards. And then there's examples of the agents that are used in these processes. All right, so this is just a flow chart kind of showing some stuff that we're going to kind of talk about, but you can use it as a quick reference because it has some stuff here that's easy to reference. I'm not going to get into that too much, but so relative resistance of microbial forms. So primary targets of microbial control are microorganisms that are capable of causing infection or spoiling food. Spoilage in the environment or in the human body. So we'll get to that. But so the targeted population often contains mixtures of microbes with extreme differences in resistance and harmfulness. And we'll talk about what that means in a little bit. Bacterial endospores have been considered and are considered the most resistant microbial entities. That means they're resistant to whatever we're trying to use against them to make them, to kill them or to, make them not viable. So if you can get rid of the endospores, if you can kill the endospores, then everything that falls underneath endospores, which is everything else, will also be, taken care of as well. The goal of any sterilization process is the destruction of the bacterial endospores. So any process that kills the endospore will kill all less resistant forms because the endospore is the most resistant. Okay? Not to be mistaken, endospore, don't let that confuse you with when we talked about fungal spores. Two completely different things, two completely different topics. So we're talking about endospores that are specific to bacteria here. Okay, just a nice little picture there for you to take a look at. We're going to hit this later here too, but you can see that this shows how resistant endospores are in comparison to vegetative forms. So if moist heat, we need 120 degrees Celsius of moist heat to kill vegetative, required to kill endospores is 120 degrees, required to kill vegetative forms is 80 degrees Celsius. So endospores are 1.5 times more resistant. I'm not going to ask you to do the math here. This is just kind of just for your general information. We're going to talk about the specific temperatures and pressure and time when it comes to sterilization later, but this is more of just for your general information. Radiation, sterilizing gas, and then the sporicidal liquid. All just general information. You're not going to have to regurgitate this table to me. Okay, agents versus processes. So sterilization and disinfection processes. So when we use, and really everything on this page, on this slide, just know if it ends in CIDE, cide, like homicide, it destroys or kills. Okay, so bactericide destroys or kills. Fungicide destroys or kills. Viricide, it inactivates because we know that those aren't alive, as we learned in Chapter 5. Sporicide, destroys or kills. Germicide, microbiocide, kills. Okay, so if it ends in cide, E, think of like homicide, like kills. Okay, if it ends in, let me see if this is in the next one. Nope, we'll get to that in a second. So just know that little suffix there has to do with killing, destroying, or inactivating. All right, agents versus processes. Sepsis, the growth of organisms, microorganisms in the blood or other tissues. Asepsis is any practice that, excuse me, that prevents the entry of those infectious agents into the sterile tissues and thus prevents infection. So whether asepsis, examples of asepsis would be wearing a mask, wearing gloves, washing your hands, wearing a gown, using a sterile area when you are in the OR, changing gloves, changing your gown, wearing a hat, wearing goggles. All of those are ways to prevent the entry of infectious agents. So any of those can be considered what we refer to as asepsis processes or any practice. So aseptic techniques are practiced in healthcare and range from certain sterile methods to antisepsis. All right, here. Antiseptics, these are used on body surfaces, on the skin and mucous membranes, wounds, surgical incisions, and antiseptics are used to prevent vegetative pathogens. We do not use antiseptics on the countertop, not specifically, right? I'm not saying you can't, but it's not. An antiseptic technically is for tissues, body tissues. So we use antiseptics to prepare the skin before surgeries, for preparing the root canal with hydrogen peroxide, and then something as simple as washing your hands with a germicidal soap. All right, this is what I was looking for earlier. Stasis. So we have cide is to kill or destroy or inactivate. Stasis and static means to stand still. So basically it doesn't kill it, it just inhibits it. Okay, so bacteriostatic is a chemical agent that prevents the growth of bacteria on tissues or objects in the environment. Fungistatic, chemicals that inhibit the fungal growth. Antiseptics and drugs often have microbistatic effects. Because if we start getting into the microbicidal compounds, sometimes it can be toxic to human cells. So even a cidal agent does not necessarily result in sterilization. It just really depends on how it's used. So if you see static or stasis, know that it is inhibits and prevents the growth. It doesn't kill it. This does not kill it. Okay? All right. So just some basic stuff here. I'm sure there's a question that's going to come through with one of these, but I'm not going to jump up and down about this stuff. So just basic stuff here, as far as critical medical devices, semi-critical and non-critical devices, and just what that means, where those devices will be found. All right, so I'm going to stop here and pick up on part 2.